and charge our beaten up batteries again for another year. And I think without this academy, uh, the development in holistic dentistry would be probably 10 years behind of where it is now. So this is thanks to the pioneering work of Ed Orana. Ed, like those of you who are new here, how many of you are here for the first time? Yeah. A large number of you had his initiation into this group really only 2 years ago when the dental board cracked down on him and he didn't do well with the stress and had a stroke. And so he's impaired, but his thinking isn't impaired. And so those of you who don't know him, you can talk to him like a regular person, even though he's a little slow in his motor functions, and he can't hold his concentration very long. But for the time that he does hold his concentration, he's completely there, actually more there than most of us. We're all looking forward. This meeting has been known for its unique approach that many times in the past, like the lectures presented here, became the material that most of us then work with for the next couple of years, and has been like historically about 7 years ahead of its time. It means that things that are discussed here during the weekend usually become the accepted truth about 7 years later, accepted by the holistic community, and another 7 years later by the conventional community, who then says they've known it all along and they invented it. Yeah. And so we're all very excited about this meeting. I'm Dietrich Klinghardt. I'm an MD from Seattle, and this gentleman over there with the dog, there's actually with two dogs, that's Chris Hassar, who is
Chris.
Oh yeah, sorry, yeah, the dog is, that's Bliss, or
it's Rambo here.
Oh, Rambo, the other one is Bliss, yeah. Chris is a DO and a dentist. He is one of the few double-boarded people in here, and Chris has been known as the leader in the cavitation work here in the US. And Chris and I are trying to sort of run this meeting here to introduce the different speakers. And so, Chris, with that, I guess, okay. Here's Ed Orana. Ed Orana is a dentist.
He's a mentor to us all.
That's not enough to hang on.
Okay, Ed, here you are.
Thank you, Dietrich. First of all, I would like to ask your participation in the 30 seconds of silent reflection on the spirit of Norma Osletten, who is the AABD book table overseer. You could put that down. And Norma passed away on February 1st, so if we could just give her 30 seconds of reflection, I would appreciate that. Tell me when 30 seconds is up. Thank you. Norma's not with us today or at this time, but she's, without her, we wouldn't be where we are. All the other organizations that have come and gone, and we survived. And we're here because of her efforts and efforts of the people like her in our organization. So let's all have a good meeting and exchange information, because that's what this is all about.
All right.
Thank you.
Thanks, sir. Before I turn over the microphone to Chris, by the way, it is still Ed who puts the roster of speakers together and selects the people that are lecturing here. So he's still highly involved in the quality and the essence of this meeting. Okay, what else?
Cheer for Ed.
What?
Let's give a cheer for Ed.
Oh yeah, well.
More enthusiasm.
Oh yeah, come on, yeah. Let's try again. Like, give him like a standing ovation. Why don't you kind of do that real quick? All right, no, that's enough now. Okay. Chris coming up.
All right, good job. Well, I think we all have Edward to thank for our change in our attitudes of medicine and dentistry. I think 14 years ago when the academy was started, we had to bend the rules a little bit. Now we are the rules, and I think it's up to us to change the paradigms in medicine and dentistry as we know it and as we were taught it. Because we know that, well, you're here because we know they don't work. Most of the time they don't work, and we're looking for alternatives. And I think that with the passing of Norma from cancer, that's one thing that we have to look at, the association between the teeth and cancer. And one of the doctors here today has some information on that, so we'll probably be discussing that sometime today. But without further ado, I'd like to introduce our next speaker, who needs no introduction. He's a dear friend of mine, Dr. Meinig, and I'm sure you've all seen his book on the root canal cover-up. Has anybody not seen or read that book on the root canal cover-up? If I have a patient that comes in and isn't sure about what root canals do or cavitational surgery, I just give them George's book and say, here, read this, and don't come back until you've read the book, and that usually will sell them on the book, and it saves me a whole lot of time. Besides that, I make $20 selling your book, George. George has a subject that he's going to lecture on, which is very dear to my heart, and that's the theory of focal disease, focal infection. And of course, if you look at the dental literature, this doesn't exist, and if you look at history, there were small pages devoted to the theory of focal infection in my dental pathology book, but now it's a daily routine in my office to take a dead tooth out or to clean out a cavitation and have somebody's chest pain go away or their rheumatological disorder go away or even tumors go away. But nobody seems to want to hear that or listen to that. So, George, are you ready to go? Your slides in there, and you ready?
Slides are there.
All right.
I'm not ready to turn those on quite yet.
George Meinig. Let's have a cheer for George Meinig. He's one of our fathers also. I'm going to wire you up here, okay? There's a pointer if you need a laser pointer, okay?
Oh, thank you. I've got one in my pocket, too.
Are you ready to go with the slides, or you want to wait a minute?
Pardon?
Should I start the slides now?
No, it's not going to be for a while. Thank you very much, Chris, for the nice, is this on? Yes. Introduction. I was just sitting here remembering that the first time I presented anything on the root canal cavitation problem was at this meeting. And that was, I can't tell you how many years back now. I don't quite remember, but it wasn't a very good talk at all. I really wasn't that familiar with what I was talking about. And I hope I've gotten a little better with it. Excuse me. Because so much new research has taken place since my book, Root Canal Cover-Up, came off the press on June the 25th of 1993, I felt that you would be interested in hearing a quick rundown of all of the good things which have occurred in the last 6 years. In order not to miss any of the key issues that are involved, I've written a sneak preview about what has taken place and how far we have advanced in our effort to completely uncover that earth-shaking cover-up. The title of this pre-lecture paper is Exposing the Greatest Medical Fraud of the 20th Century. Whoop, gonna have to stop already. This isn't vodka right now. This is my reverse osmosis water. I probably could use the vodka. Neither the Root Canal Association or the American Dental Association or the public are aware in any way of the scheming, intentional actions carried on by just a few dentists and physicians who gathered together over 75 years ago to discredit and cover up the extensive focal infection research discoveries. In addition, it was the unbelievable bad judgment of the two past presidents of the ADA and a leading physician bacteriologist who prepared and presented fraudulent scientific articles which were the prime cause that influenced dentists and physicians ever since that time to reject the remarkable studies that had been made about focal infection. The dreadful tactics of these various negative individuals over 75 years ago proved exceedingly successful in stopping dentists and physicians from reading the numerous scientific articles that were published about the focal infection research. Now, we've said they've been covered up, but that research was always available, but they were so successful, dentists and physicians quit looking at the research. So this is what we're involved with. Those studies proved bacteria easily become trapped in the deeply decayed teeth, causing a wide number of degenerative diseases. What instigated this group's fight against the focal infection research was their aggravation about the scientific reports of the nation's three leading scientists. They were Frank Billings, MD, America's leading physician at the start of the 20th century, E.C. Rosenau, the world's most renowned bacteriologist who headed bacteriologic research at the Mayo Clinic for over 30 years. And then there was the third one, Weston A. Price, DDS, MS, America's leading dental research specialist. The key issues that most the objectors the key issues that most disturbed the objectors were the discoveries of the root canal treated teeth always remain infected no matter how good they look or how good they feel. And this is one that even many of you out there aren't telling people, but this is one that really shakes them up. Secondly, they despised the researchers' discovery that teeth are due to 95% of all focal infections. And I was just reading a book by Billings, who introduced the focal infection theory, in which he said it was 99%. So I'm not sure, but somebody else had come with 95, and that's what I'd been using. I'm happy to be able to tell you that startling amounts of new research have burst upon us during the last 6 years since root canal cover-up came off of the press in 1993. It is this unexpected large volume of new research which is the main reason for my reporting all that has occurred. I believe you will find it very exciting. Many of us wonder how the three scientists, Many of us wonder how the three scientists could ever have been able to make such revealing and learned discoveries. Please take note, their research was actually so extensive that during the same 50-year period, these three scientists carried between them a combined total of 100 years of research time. And that was all about the side effects of focal infections. In that 50-year period, the three scientists used 16,000 animals to prove and establish the truth of their experimental endeavors. You can readily see the opponents of the focal infection findings in their actions to discredit Billings, Price, and Rosenau, that they ended up committing scandalous, unpardonable acts against humanity. The dishonest actions used in closing off these crucial studies to dentists and physicians forced millions to suffer. Just a minute, I'm going to take a chewable C and I'll cure that in a couple of seconds. Got to do that every once in a while. The dishonest actions used closing off these crucial studies to dentists and physicians forced millions to suffer from a wide assortment of degenerative diseases. A large percentage of those who develop degenerative diseases die before their time. You know, you physicians do a remarkable job of keeping people with degenerative diseases going for a long time, but we all got to remember that most of them with degenerative diseases do die before their time. And this is what happens from focal infections. You end up with degenerative diseases. That is why the cover-up actions resulted in the biggest medical fraud of the 20th century. The most significant problem brought out by the research 75 years ago was that 90 to 95% of the structure of a tooth, called dentin, is made up of very tiny tubules. When the tooth decay eats deeply into a tooth, the bacteria causing the decaying portion easily and eagerly find their way into those tubules. Though the bacteria are said to be locked or trapped in the dentin tubules, they and their toxins can and do metastasize and escape into the blood vessels of the tooth's bony socket. From there, they travel the body via its blood supply and set up a whole new focal infection in another gland, organ, or body tissue. These infections are what end up producing a wide assortment of degenerative diseases. Should you still have some doubt about all of this, in a few moments during my lecture, which follows, I'm going to show several greatly magnified electron microscope pictures of dentin tubules loaded with bacteria. These slides are startling proof that no one, I don't think even the Endodontic Association, to which I am still a life member, surprisingly, knows or does anything about. From 1915 to 1928, Dr. Rosenau, as part of his over 50 years of bacteriologic research about the severity of focal infections, listed among his 300 published scientific articles the names of 137 degenerative diseases. That list appears on the next page and has been made available to you by Carol Arana. It'll be, I think, out in the room. Just a few of the major degenerative diseases caused by root canals that are on the list are coronary heart disease, rheumatic fever, encephalitis, pernicious anemia, multiple sclerosis, trigeminal neuralgia, brain tumors, lupus, colitis, arthritis, and a whole host of eye diseases. Over the years since that time, that list which is 137 long, incidentally, of focal infection degenerative diseases has grown significantly. This is what the list looks like. You can get them. Carol made them up for all of you, so I think you'll want them. Each of these illnesses has been proven by numerous studies to be associated with bacteria that are trapped in teeth. Are you, any of you, victims of these diseases? If so, you better look at your own dental oral conditions. Please don't jump to the conclusion that I have a vendetta against root canals. On the contrary, it was one of my 3 favorite subjects as a dental student. That interest led to my being given postgraduate training in root canal therapy by Dr. Edgar Coolidge. He was the professor and research teacher. He was the foremost one in the whole world in the treatment of root canals therapy. I was fortunate that he was our professor in the school I went to, and it's another story, but I may get a chance individually to tell you about it, of how I got on his good side. Early on, I taught the subject to dentists at meetings around the country. Was an active member of Dr. Coolidge's Root Canal Study Club. I was one of the 19 dentists that started the Root Canal Association. And that was back in 1943. Because of my nutrition and root canal background, I was selected to manage the new dental office at the 20th Century Fox movie studio back in 1946. You can see I really loved the challenge of trying to save teeth and was certainly not against root canals. During my 47 years of practice, I treated several thousand of them. It was after all of those years of practice and during my retirement that I was suddenly introduced to the long-buried, covered-up focal infection research of Dr. Weston Price. And through him, I became acquainted with Billings and Rosenau. Well, I'd known about Price for years because of his nutrition work and was a member of the Price Foundation board of directors and thought I had read everything he had ever written, but those 2 books on the root canal work were buried on a shelf in a corner and a lot of stuff on top of them, and we never learned about them until January of 1993. Price's 2 enormous books, which document his 25 years of root canal research, were given to me in January of '93 by the Price Foundation. Because of the huge number of root canals being treated, they requested that I report the current efficacy and status of the Price research at that time about root canals to the Foundation's board of directors. Obviously, they knew there was a lot of static against root canals, and so they thought that as long as this was a big part of Price's work, they better know whether it meant anything anymore. Anyway, these 2 volumes contained 1,174 pages of Price's discoveries about the serious side effect problems dentists face in treating root canals. What is so incredible is that I had never heard a single word about all of this focal infection research in my entire 47 years of practice, nor had any other dentists or physicians that I've ever run across, except one, and that was Ed Arana, and he happened to have the 2 original books of Price's, and he said, I've known about this for quite a while. The reason no one has ever heard anything about all of this was the fraudulent burial and cover-up of all of this research, and it was so well carried out, it soon became the law of the land. Now, it really wasn't a law, but what happened is the Endodontic Association, in its wisdom, decided that all dentists should not take out teeth, and if they took out a tooth that an endodontist thought he could save, that this was malpractice. And they passed that message on to state boards all over the country and made it very difficult for dentists to take out teeth, because if some endodontist got a hold of them, they could threaten to take their license away. Well, the worst part of this is they even got to the oral surgeons. And I didn't think they could ever get to them, because they're the epitome of diagnostic ability, you know. And here, all of a sudden, you can't go to an oral surgeon and have a tooth out, because he's got to send you an endodontist first to find out whether the endodontist thinks he can save the tooth, and if so, he's lost the patient. So this is kind of, it really never was a law, but it was a decree set up by the endodontist to foster endodontics. You can imagine, with my background in root canal therapy, the extent of my shock that I too had never heard anything at all about focal infection research except the perpetrator's propaganda that it was all a non-issue and it was full of incorrect assumptions. And they have tons of that stuff that they pull. Sure, dentists and physicians learn about what focal infections are, but they don't learn a thing about how teeth are the cause of many of those focal infections. In fact, over 95% of them. Please keep in mind, during all of these years, the dental establishment has never come up with a single peer-review study which disproves or invalidates the Price, Billings, Rosenau research studies. And they've had plenty of chance to do this, but they have never come up with any. They come up with a lot of things they call their studies, but never a peer review study where all of the evidence is there, and they just haven't done that. The American Association of Endodontists does present 18 articles that encourage the practice of root canal therapy, but none of these articles offer any direct evidence that focal infection research discoveries were inaccurate, unwarranted, or unproven. My discovery of all of this long-buried focal infection research led to the predicament of just how in the world all of this covered-up research information could now, after 75 years, be brought back to the attention of the public and to health professionals. After a couple of months of debate with myself, it seemed unlikely that we would ever find anyone with sufficient background to be willing to tackle the dental establishment's avoidance of the truth. And I was enjoying my retirement. I wasn't just exactly looking for something to do. So desperation over the millions who were ill from root canals finally led me to personally bite the bullet and take on reintroducing the long-lost focal infection research to the public and professions. This was done by my writing and self-publishing Root Canal Cover-Up. It covers in lay language a well-rounded summary of the basic research of the three great scientists. I became experienced writing for the public during 17 years as a columnist. My weekly Nutritionally Speaking column called for transforming technical and scientific language into lay terms, because very often I quoted the New England Journal or Lancet or some other top journal, and I couldn't use their terminology. Nobody would read it. So I finally learned how to do that. Perhaps with my background, I felt that it might I might be able to find the right words to lead the public and the profession to see the true importance of all of the bacteria hidden in those dentin tubules and the numerous side effect illnesses which do come from teeth. As I have stated, my book came off the press on June 25th of '93. In publishing the facts about the side effects of root canals, its impact was immediate for those patients who had spent huge sums of money going from doctor to doctor trying to find out what the cause of their illness was. Many who would see the words root canal in the title of my book would say, gee, that's when it all started, when I had that first root canal. Well, Many others didn't find that until they read the book, and then as they read the book, they said, "Oh gosh, that's my story all over again." In addition, the book pointed out for the first time to physicians the true etiology of all of those medical focal infection illnesses suffered by their patients. Many of them came from focal infections. Many more of them came from focal infections than from infectious diseases such as measles, mumps, syphilis, TB, and so forth. You know, up until now even, the main practice of dentistry, of medicine, is to treat illnesses, infectious illnesses caused by bacteria, and usually it's a single bacteria causing a single illness. During the slide presentation, I will cover why some patients do not develop illnesses until some later time. It is that lag in time which has led endodontists to believe their treatment efforts are usually successful. And they use this over and over again, saying, "Hey, my patients get along for long periods. You can't be right that this stuff is bad." Well, their misconception that root canal treatment has been successful actually was accomplished by the overworking and eventual wearing out of the patient's immune system. Now, they do admit that it's their immune system that's helping them, but they don't sense. As a matter of fact, many of you don't sense. That's one of the things that's been coming out of this work, and that is that immune system just literally becomes pooped out from getting rid of all of the bacteria that are coming from those teeth. Although the press has not given any coverage to this greatest medical fraud of the 20th century, thanks to you in this audience, past efforts in support of these problems and past support of these problems, my book will soon go into its 6th printing. For your recognition, help in spreading spreading the word about this catastrophe, I will certainly be ever grateful. For the past 6 years, I've been invited to speak to medical and dental and other health organizations around the country on over 50 occasions. That includes a medical organization in Germany and a dental association in France, in addition 60 radio interview talk shows. Most of the time, I don't do those by reading them anymore. I do those extemporaneously using a lot of slides. So you'll have to excuse the not being able to present this without a few guffaws here and there. Upon hearing a summary of all of the past buried research, listeners readily grasp the serious consequences of the cover-up of the focal infection research. They also easily understand the reasons why this cover-up was forced upon the world. The success of the focal infection research, unfortunately, has not influenced most of the dental establishment. It is not hard to see why the Root Canal Association and the many dentists who frequently treat root canals, just why they would have a personal and financial prejudice that would lead to their rejecting information coming from coming from the use of root canals. It's obvious to most people that endodontists have a financial gain, but they also have a very definite desire to save teeth. And that's not a bad thing on the part of a dentist. It's just that they don't stop to look at the research. The success of the focal infection research, unfortunately, has not influenced most of the dental establishment. It is not hard to, I've said that, okay. At the time I wrote my book, I had learned only a few of the reasons and the causes involved in the cover-up. During further investigation during these last 6 years concerning the enormous amount of studies taking place on this subject, I discovered there were actually 7 reasons involved for the burial of all of that Billings, Price, Rosenau focal infection research. To top that, 6 years ago we had no inkling of the stupendous amount of new information that would explode upon us. All of these new discoveries now grace the scientific literature and prove the focal infection research of Billings, Price, and Rosenau 75 years ago was absolutely accurate and true. So much good news has occurred that it calls for a new book to alert the public and health professionals. I am really not anxious to produce another book, but root canal time bomb is underway. The new research and the amount of it proves without a doubt the incredible accuracy and truth of the Billings, Price, Rosenau studies so long ago. And although we think that there's plenty of proof anyway, it's what's happened in these last 6 years that has been outstanding. The past push to save teeth is really a good trait for a dentist, but in so doing, we dentists must not close our minds to any opposing views that are presented. By all means, the health and welfare of the patient must be the paramount consideration in determining the worthwhileness of any particular study. And that's all in the ethics of the practice of medicine dentistry, and yet it is avoided completely by the Endodontic Association in looking into that research. They just make excuses because of those first few things that happened in covering this up, and they have taken the word of some of their brethren as being the gospel. Reading the list of the great new information producers, there is first Jerry Bacot, DDS, MSD, Director of Research for the Maxillofacial Center for Diagnostic Research. His biopsies of the extracted root canal teeth and their sockets and cavitation areas are now carried out for dentists in 38 states. The results have verified the presence of a variety of organisms present in the oral cavity. Dr. Bacot's autopsy picture of a cavitation in the mandible of a trigeminal neuralgia patient is a true classic. I will show that slide picture in my lecture that follows. Then there is Boyd Haley, PhD, Professor of Chemistry, University of Kentucky. His discovery using a new method of identification of the toxins coming from the bacteria present in root canal teeth and the extent of their toxicity has captured the heart of the dental profession. Dr. Haley's work confirms the remarkable studies made 75 years ago by Dr. Weston Price concerning the serious health problems caused by the toxins produced by bacteria in teeth. You know, Price was able to isolate both the bacteria and the toxins coming from teeth. He put them in separate vessels. He injected toxins in one group of animals and bacteria in another group of animals. And those animals that got the toxins got sick sooner and died quicker than those that got the bacteria. It was a very distinct thing, and this is what Haley is now proving. And now then there's our great Christopher Husser, DO, DDS, with his wonderful surgical expertise and lecture presentations. He has contributed outstanding amounts to our knowledge of the intricacies of this work. He is our best answer. He is our best advisor and our best critic. Give Husser a hand because he is really something. Captain Bob Jones, president and inventor of the Cavitat, and he's here in the audience today. That's an acoustic scanning device, as I think most of you probably know about. His research studies have brought better understanding of how the cavitation infection problems spread in the jawbones. And then there is Hale Shackman, who brilliantly discovered that the Dr. Holman fraudulent illegal manipulation of the Rosenau research, it was in only in 1997, some 71 years after the publication of Holman's work, that Shack discovered the long scientific article that was done by Holman was full of inaccuracies, was full of made-up data, which is absolutely false, both from the standpoint of what he reported on Rosenau, but what he reported for his own thesis. And so this was done in 1928, and it became such a part of the whole business with the Root Canal Association that this is what allowed them to advance to become the most successful specialty in dentistry. Shackman presents all of the details in his book, Fraud and Root Canals, Medicine's Greatest Fraud. Institute of Science, P.O. Box 382, Santa Monica, California, 90406. Shackman also has so thoroughly researched the Rosenau studies that in 1997 he produced the Rosenau Reference Manual, the medical guide for the future. And I kept saying, gee, how am I going to pull all of those Rosenau records out of their literature? That's a real chore, but he's got almost 300 of them. And here Shack had done this all for us by having them listed. So in addition, there are many others who deserve to be mentioned. Truly, their great results must be added to the contributions of these men. To learn how they to learn who they are and their research, I suggest that you go to Medline on the internet under the title Focal Infection Dental. When you do that, you will receive 2 large discs containing the names, titles, and summaries of the articles about root canals and cavitations that have resulted from research by scientists around the world, and these that you're going to get date from 1963. There were numbers of them before that. I reported a few in my book, but the Endo Association always has claimed that there isn't anything. You will find these scientific literature citations date back from 1966 to 1997. And as a matter of fact, in the last month, they announced that they have 75 more that deal from 1997 to 1999. And so I think I said that there were, did I say there were 1,400 of these? Maybe I'm getting to that. It's important that all of this information be reported, as the Root Canal Association claims the 75-year-old focal infection research was not up to standard, that it is too old to be successful, and nothing new has come along on this subject of root canals. Because 95% of all of the dentists, the lead of the American Association of Endodontists, I'm sorry, because 95% of all dentists follow the lead of the American Association of Endodontists, it is necessary for root canal time bomb to be published in order to bring the truth to the dental establishment and to the world about all of these more recent discoveries, which we really didn't need in the first place, but now solidified so greatly the importance of this work of focal infections. Because of the sheer intrinsic volume of all of these new discoveries, which so thoroughly substantiate and authenticate the accuracy of the 75-year-old focal infection research, it is my belief that the press will finally take notice. Once one becomes aware of how many millions of people have root canals, and that's now said to be 30 to 40 million per year being done, their mouths, well, once one becomes aware of how many millions of people have root canals in their mouths and are ill from the bacteria trapped in their teeth, they then are able to realize why it is so important that dead teeth be removed and be replaced with bridges and partial dentures. I can assure you, in presenting these well-established facts, that this greatest medical discovery of the 20th century will enable people at long last to be free of the much too numerous focal infection degenerative diseases and of the pain and suffering they cause. In addition, the knowledge about how to recognize and eliminate these serious infections will save us from dying before our time from the degenerative diseases that result. With all of the new research developments to be covered in my upcoming new book, Root Canal Time Bomb, I feel assured the press will awaken to the great need of people everywhere to learn about this information. It is time for the extensiveness of the focal infection catastrophe to at long last become known. Are you prepared to go to work? It's going to be more than what we can handle once this happens. Those of you who treat focal infections realize the enormity of their number. Your pioneering work in pushing the recognition of this calamity makes each one of you great contributors to the world's best story. That world's best story is the struggle of man to right terrible wrongs. From the bottom of my heart, I humbly thank all of you for being here today and for what you're doing to acquaint the public about focal infections. And now, to get on with the lecture time, I've taken a lot of time away from what I was going to present, so I'll have to cut some of the things off of that. But if you'll turn the projector on now, we'll get right to work here. Oh, is this? I didn't get instructed here. How do I turn it on? Oh, there we go.
Point it this way. Point the instrument this way. Towards,
I can't hear you.
you have to point the instrument towards the slide projector.
Point it towards the slide projector.
I find it on the
That's your automatic advancer, George, and I think you have to point it like this.
Oh, okay.
There you go.
Okay, thank you.
Looks like you.
Well, that's a compliment. Let me introduce to you Dr. Weston A. Price, dental research specialist, a true genius, if there ever was one. From the time he graduated dental school, he spent half of his time doing dental research and the other half practicing dentistry. At one time, he was even slated and announced as being the world's best dentist. In spite of the fact that the Endodontic Association keeps depreciating his abilities, they say, oh, well, this is all old stuff, and he didn't really know what he was talking about. Well, anybody that reads his two books, and incidentally, those are available from the Price Foundation. The originals are. They're copies of them, because to reprint them would be too costly for them to be able to do. So they have them copied, and copied with modern equipment are as good or better than the originals are. So if any of you really want to get it from the horse's mouth, you can do so. Revolutions start with one person, and certainly between Price and Rosenau and Billings, there's more than one person, but they really started a revolution that we're all involved with. These are the two books that Price documented all of his data in. And I put them on this table thinking they would be shown in their grandeur, but they look smaller than they really are. But these two books list all of the documentation of all of his research findings, and full of pictures, and there are 1,174 pages here, and it is really some reading. Now, Price is sometimes accused of not being that popular. He was probably more popular with the Medical Association than he was with the Dental Association, but he was very popular with the Dental Association. And this was one meeting in which he attended, in which he gave him recognition for some 17 different things that he did for the public and for the profession. And this was signed on the bottom there by 26 past presidents of the American Dental Association. Do you know anybody that had 26 presidents? say what they did was pretty good. Well, not clipping.
Gotta aim it at the slide machine. Aim it at the projector. There you go.
Now, particularly for the dentist, I'm going to take you back to dental school. So you learn a little about the anatomy of tooth. Actually, most of you know a good deal of what I'm going to present here, but there will be some things that you probably didn't know about this subject. You all know, of course, about the enamel covering the crown of the tooth, and it's a hard calcium substance. And you may not know, but the root of the tooth is covered with cementum, which is this little thin yellow line here. It's almost as hard as enamel, but not quite, and not as thick because it's not under as much stress. All of the rest of the tooth, that's what's here, which represents roughly 95% of the tooth structure, is composed of dentin. And that dentin is composed of tiny tubules. And those tubules are being represented by those lines here. That's not exactly the way they run, but that's what's being done to tell you about the tubules. Those tubules are very tiny, less than 5 microns in size, and in their normal life they carry a fluid, and that fluid carries nutriments. Now, in the inside of the middle of the root canal is a canal, and that canal, everybody knows, contains a nerve. A lot of people don't know that it also contains an artery and a vein and other tissue as well, or that they have lateral canals or accessory canals that come off kind of like the branches of a tree, which also supply sustenance to the tooth. Now, what happens is as that artery comes into this tooth, it spies these dentin tubules, which open up under this canal, and it drops off nutriments into the canal, into those tubules, the same way that arteries drop off nutriments to every cell of the body. Now, from there, this fluid with the nutriments travels from the root canal to all parts of the tooth. Up here, clear up into the enamel. And it is those nutriments which keep teeth alive and healthy. And so, this is Dr. Ralph Steinman, Professor Emeritus, Loma Linda University, and he did a lot of this research that I'm talking about the dentin tubules. And I got to know him before I got involved even in this business of root canals and things. And so when I did get involved, I kept in touch with him on telephone about what was happening. And I consequently got a little more of this information than the average dentist got, because most of them never heard any of this when they were in dental school. Here we see the caries procedure in different stages in the tooth, and once the decay breaks into the dentin of the tooth here, you got to realize that the bacteria that are partly the cause of the decay are going to get into those tubules. Now, those of us that know something about this have felt that, well, once the dentist cleans out the decay and a little of the good tooth along with it to be sure he's got it all, we have thought that it probably took care of those bacteria in the dentin tubules. But one of the queer things is we don't know whether it's taking care of it or not, and we're not sure what's happening with that. Now, of course, you can picture that if the cavity is very deep, it's getting precarious to have the bacteria get into the root canal itself. And of course, there's no question of what happens when the decay exposes the root canal. Then the bacteria have free rein to travel down that canal, and of course they eventually set up infections at the end of the root of the tooth and so on. Now, as those bacteria travel down this canal, they spy those dentin tubules and those nutriments, and they say, wow, this would be a great place for a summer home or a winter home, and they set up housekeeping. And within a short period of time, those tubules are loaded with bacteria. Now, this is a picture the best microscope that Price had at the time he was doing this research. This is low powered, and this is the decay breaking through the dentin into the enamel breaking through into the dentin. And here's a high powered magnification. And when you look closely, this is the dentin tubule. And if you look very closely, you see little black dots all along here. Those little black dots are the bacteria in the tubules. Now, I didn't know about bacteria in dentin tubules until I saw this picture in those two books in January of 1993. That was the first I had learned about it. And since then, I told you I've spoken to a lot of groups, and numbers of them with dentists were present. And I noticed that they were always dead silent when I brought this up, which meant that they never heard about this either. So I'm sure they didn't, because this was in those two books of Price's, and they were published in 1923. And so this stuff has been available for a long time, but nobody other than Ed Arana ever saw any of this. Here's a electron microscope study of dentin tubules, much enlarged, and so you can plainly see how large those tubules are. In this case, there was a break here, and so you can see that those tubules don't run uniformly, but intermingle with one another. It's that intermingling with each other that makes the tooth so tough, or that is the dentin so tough, because when a dentist drills on the enamel and into the dentin of the tooth, preparing a cavity or a crown or something, you can't tell from the sound that he's on any different tissue. It all sounds like he's cutting into hard stone. Well, it's still, those are still tubules. Now here's the greatest one of all. These are large 5,000 times. These are the tubules. And here you see clumps of bacteria in the tubules. So you get a first-hand look at what bacteria look like in the tubules. Here I did on the drawing, I did a root canal on the one side and left the other side so we could talk about things if we needed to. A lot of people wonder what's happening in a root canal, and once this becomes infected in here, it comes through, that tissue dies, and it becomes kind of garbage tissue, and the patient has pain and swelling and so on because of the pressure produced by gases and the toxins that are involved here. When a dentist opens up in there to treat this, he uses broaches to clean out the dead material, and then because many times those canals are too small to get enough adequate irrigation and disinfectant in there, he enlarges the canals so that he can adequately work with this. And he does that with files and reamers. And then he, of course, saturates it with disinfectants and eventually does a root canal filling. And so that filling should be at the end of the root of the tooth, but unfortunately there's never been a filling yet with all of them that have been developed that adequately does that, because after about 2-3 weeks, the material, no matter how well it's been condensed and put into that root canal, tends to shrink some and leave spaces, and those spaces, of course, can eventually pick up bacteria. Well, it all starts with a teeny cavity, and so if your dentist someday says, well, you got a few little ones there, but you don't have to do anything about them right now, you better find a dentist who will do something about them right now, because those little ones tend to end up to be bigger ones, and then you need a root canal, and I don't think you ever want to get into needing a root canal. Now, everybody thoroughly believes that the x-ray will show everything, and although the dentists say it doesn't, except if it's an endodontist saying it was a good treatment. Here's a condition which shows why you can't tell that. This is the tooth from the front view of an x-ray view of it. But if that same tooth is turned to its side, you see that one of those lateral canals had a large granuloma infection area right here. Well, it's here, but you can't see it here because the tooth is so dense that it hides that. And so you can have all kinds of things that are that way, or you can have this infection present here, but it hasn't gone far enough to show this, and so you don't know that either. And so when you look at an x-ray, you can't tell anything really definitely about what's going on. Well, Dr. Price knew Billings and he knew Rosenau, and he was pretty much aware of what they were doing, and he knew that they were isolating the bacteria in the teeth, growing the bacteria in culture, and then injecting culture into animals to see what would happen. Well, Price had good success with a number of arthritis patients, and but this was the first one, and he had done a root canal for this woman, and she developed sometime afterwards the severe arthritis. She had been a woman who sewed for a living and did hem stitching and all kinds of things, needling, and she could only get along in crutches or in a wheelchair, and she spent most of her time in bed. And when Price learned about Billings and Rosenau's stuff, he said to this woman, "You better let me take that tooth out. I want to do some experimenting with it." And she, of course, refused, like most people do. They don't want to lose a tooth. And so she tolerated it, and as she got worse, she finally permitted him to remove the tooth, which he did one day, one morning, and he had secured a laboratory animal. In this case, it was a rabbit. He made a little incision in the back of the neck of the rabbit, and he removed that tooth, and he root canal tooth, and he put it under in that incision. He put in a couple of sutures to keep the tooth from falling out, and he transferred the rabbit back to its spacious cage, which had plenty of good food and water, and awaited developments. Well, it didn't take long. In just 3 days, that rabbit had the same arthritis in its limbs that the patient had in her limbs. And in 10 days, the rabbit passed away from the infection coming from that tooth. Now, Price was an expert at taking health histories. He took it not only of the patient, but of the patient's father, parents, and the grandparents as well. And so he knew pretty much about taking histories of people, and he said to himself, gee, if this could happen to an animal in just 3 days with an arthritis, what's happening with people who have a heart problem, or have a kidney problem, or have a liver problem, or have...
I'm just remove this because we don't need this anymore and we can't see your face.
Thank you very much. That is a help. And what he found was he started taking these teeth out and implanting them under the skin of an animal, and they could use all different kinds of animals. Most of the time they used rabbits because they were an easier animal to have in a laboratory situation. But invariably, in the majority of cases, the animal got the same disease as the patient. In other words, if the patient had heart trouble, the animal would develop heart trouble. If it was kidney trouble, it was kidney. If it was eyes, it was eyes. If it was brain, it was brain. Didn't matter what it was, they usually got the same. It wasn't 100%. Sometimes they got other diseases instead. But a good majority did get the same disease as the patient. Well, here we're going to show you a woman who had heart trouble, and unfortunately, the picture here doesn't show this too well. I had to take this from the book with my camera, and it wasn't that good a camera. So, but you'll have to take my word. But this was as good a root canal as we ever see. It was right to the end of the root of the tooth. There was no sign of any infection at the ends of the roots of the teeth. This patient was having no symptoms in the tooth, no pain or discomfort, no problems of any kind. But she had heart trouble, and so Dr. Price said, "We better take those 2 teeth out," and they did. And this was the first one was planted under the skin of an animal, and that animal developed endocarditis, which is what the patient had. And this is that endocarditis heart. This is the other tooth, and this is the other animal, and it too developed endocarditis in its heart. And so Price did all kinds of different diseases. I only show a couple of them so that you get some kind of a view of what is going on with this. Here's a patient, 2 different patients who had bladder infections. This particular rabbit developed this exceedingly large distension of the bladder because of the infection. And this other animal, which is a separate study with another patient, and it has a perforation of the bladder at this point. Now here's a woman who's got a ovarian cyst that you're seeing here, and this is in a rabbit. And what Price talked about very often was that women who had root canal filled teeth or infections in their mouth, they very often developed disturbances of their female organs. These could be all kinds of different things. They could be tumors, and they could be inflamed tissue. They could be all kinds of different things. But he claimed that this was very often. Well, this woman had an ovarian cyst, and the rabbit developed an ovarian cyst, as you see here. And it's surprising, but any woman who has a root canal better darn well get it taken care of, get it out of there, because she's eventually going to develop something in her uterus that will be a problem. Dr. Hubert Newman, a professor of dentistry in the dental school in England, wrote this article about 3 years ago on focal infection, and I was so impressed with him writing about it, because I didn't find anybody was talking much about it except me, and so and some of you people in this group, of course. But I wrote a letter to him and thanked him for doing this. It was reported in the British Dental Journal, and they criticized it quite highly as not being factual. But it was a very good article, and this was some other information on this subject. This I've already talked about, although I didn't talk about them as being the Three Musketeers. But Billings, Rosenau, and Price are the key researchers. The other people have done a lot of research, but they did so much of it, 100 years between the three of them of time. So now here's a woman who has a very inflamed eye here, as you can see. Her eye doctor was trying to treat her for over 30 days and was getting nowhere, and she happened to be into her dentist to have her teeth cleaned, and he noticed that she had this eye problem, and he said, "What's the matter with your eye?" And she told him this history, and he said, "Well, we better get some x-ray pictures of your teeth." He fortunately knew that the teeth could cause some eye problems, and so lo and behold, she had an infected tooth here, an infected tooth here, an infected tooth here, and so Dr. Price implanted those under the skin of rabbits, and the first rabbit was almost blind in just 2 days, and this one was totally blind in 2 days, and he didn't say what the third one was, so I don't know what happened with that. But you get a chance to see. Now, a lot of people say, well, he didn't have any controls. But Price did have some controls. What he did was he went to several oral surgeons, and he said, "I want you to save aseptically every healthy tooth that you take out." Now, why would they be taking healthy teeth out? Well, because of orthodontic purposes, because of impactions, because of maybe injuries that have occurred or something elsewhere in the mouth, and you have to remove another tooth. There's a lot of reasons sometimes for removing a healthy tooth. So he says, you do that and save that, but you got to do it aseptically. You know, you got to be surgically clean and taking the tooth out, and you got to put it in this solution so it doesn't get contaminated. And then he took these 100 teeth back, and he implanted every one of those 100 teeth singly under the skin of a different animal. And he used all kinds of different animals to prove that this wasn't just one animal that would do this. What do you suppose happened? That's right, not a thing happened. These teeth lay dormant, and this is one of them, under the skin for the entire length of life of the animal. Unlike when the tooth was infected or had a root canal, the animal got sick almost immediately, and within a couple of weeks it was very obvious that they had a problem. Now these went for the entire life of the animal. Once in a while, in a few of them, they would develop what looked to be like a cystic sac around them, and of course this could be an infection. And so Price would go in bacteriologically and check those teeth for bacteria, and he found that they were always sterile. And so in other words, he had controls of 100 healthy teeth that showed no breakdown. The Root Canal Association, they don't know what they don't know. And if we could only get them to read the Price's literature, they would know what they don't know. Now, one of the other things that's come up in the last couple of years and hit the press as a matter of fact, and that is periodontal gum disease. And here you see a deep pyorrhea pocket. This bone used to be up here. This bone was up here. And this is destroyed, and this pocket is usually full of infected tissue, bacteria, and they came out with a big study which hit all the headlines a couple of years ago, that periodontal gum disease was one of the big causes of heart attacks. And so this was quite a claim, because they were talking about, very frankly, that these were focal infections. And so this was an interesting situation. It became even more interesting because the editor for the American Dental Association, after this came out, wrote an editorial that hit the editorial page of the ADA Journal, and its title was, "Focal Infections Return with a Bang." And of course he didn't mention root canal teeth. They're still avoiding that like a plague, but nevertheless, here's another deeper pocket. You got to know that periodontal problems have got to be taken care of. Now, Price did all kinds of studies in doing this. He just didn't take teeth out and put them in an animal and look at them. He did all kinds of blood studies for the patients and for the animals the same way, and he found all of these things were affected, either higher or lower readings than normal when infections were present in the patient and in the animal. Ionic calcium was one of the key things that he did, and we don't have much that appears on ionic calcium. Occasionally, and when you get a blood analysis, you'll get an ionic calcium reading. They usually determine that mathematically rather than doing a actual study of it, but they can do a study of it. Ionic calcium means that the calcium has an electric charge, and one of the problems is that most of the calcium people get don't have that, and if you don't have enough hydrochloric acid in the stomach, when that goes through the stomach, it ends up as being a detrimental product in you rather than a beneficial one, because it's that acid that helps ionize and make the calcium ionic. Now I'm going to get into, I'm going to switch to the next slide and just avoid that one to cut down time. Bacot has come up with this title, NICO, which stands for Neuralgia-Inducing Cavitational Osteonecrosis. That'll kind of make you gag a little bit just to say it, but it says it exactly the way it is. All of these cavitations create neuralgia, or practically all of them do. They induce cavitations. In other words, they induce a hole in the jaw. And a cavitation, incidentally, it's like a cavity in a tooth is a hole in a tooth. A cavitation in the jawbone is a hole in the jawbone, and it's full of dead bone cells. And so that's what this is saying. It induces cavitations. And then it says osteonecrosis, which you probably all know, means this is bone, and this means dead, and that means dead bone. And so this title describes this process entirely, and that's why he is using it. Now I'm going to show you a few of these. This is a third molar wisdom tooth area, and you see this large circle here. That's a very large cavitation area, and we see them very often in third molars. This looks like two, but this is actually a ridge of dense bone that goes in the mandible, and so it cuts it, makes it look like it's two, but it's all one big hole. If you look closely, you see another one over here. You can see this one actually comes into here too, a little bit. And here's a very large one. This is done by my friend Michael LaMarche up in the Seattle area. This woman had that first molar removed 30 years before, and from that time on she had health problems, and nobody could ever find out what was wrong with her health problems. Well, she got in to see Dr. LaMarche, and he found this, and he said, you better let us remove that, and she did. And in 2 to 3 weeks time, all her health problems had been resolved. Here's another one. This shows what happens is that the infection remains in the periodontal membrane, and this is the remnants of the periodontal membrane, when of course it was much smaller than this. You can see how this infection is spreading through that. Here, because this is very cancellous and mushy bone, the dentist just pushed this needle through to its depth and then took a picture of it, because some people would deny that that it was this deep. And so he wanted to show that was how deep that really was. Now here's one with an edentulous, a woman who had all of her upper teeth out. And when I'd heard about this, I said, gee, I saw a lot of those in practice. I wonder if I don't have some in my files up in the attic. So I went up in the attic, and I don't think it was 5 minutes before I ran into this one. And here you can see where the periodontal membrane was for this tooth very clearly. And you can see where it was with this one. Now here it looks like mishmash, but that isn't so. This was a first molar area, and the first molar's got 3 roots. And so you got 3 roots giving off these periodontal membranes, and each one of them was still infected. So you can see how this can spread in cavitation areas and involve the whole jaw eventually. And I'll show you a picture about that in a minute. I'd like to introduce you to my wife, but some of you met her before. She's a little better looking than this. Strangely enough, she and I both had 7 cavitation areas, all 4 of our wisdom teeth, and then 3 other teeth that we had removed. Now, you won't see all of these that clearly on this picture, but when you look at the film itself, you will see some of them. This one isn't hard to see. This one isn't too hard to see. This isn't too hard to see here and here on that impacted tooth. I don't know whether you can make it out there or not. But this is very interesting because Eleanor's second bicuspid became infected, and at the time this happened, I didn't know anybody in our area too much that was doing these things, except one man who said, oh yeah, I do these all the time. And it turned out he was a pretty good talker. And so we set up the appointment, and I came in, and I thought he'd do this tooth, and then he'd do this, and he'd take this out, and he'd do that, and he'd do it all at once, you know. He said, oh, no, that'd be too much. I'll just do this and take the tooth out and do this. And so he did the recommended protocol that we have for removing the periodontal membrane when he took out the tooth. He did all of that very well. Then when he got into doing this, I knew he didn't know what he was doing. And I'm standing there going from one foot to the other, wondering what to do. Do I tell him I want to take over, let me go finish this, or what? Well, that's an embarrassing position, and then you're working with somebody's stuff, you don't even know what you're working with. And I just shut my mouth and gritted my teeth, and I knew that he never got into here. Well, in the meantime, I had learned from one of Chris Husser's classmates who I'd met at a meeting that he was very good at this sort of thing. And so I had been referring patients to him and had numbers of people call me back and tell me how good he was. So I felt pretty comfortable with him, and I called him and said, hey, I got a problem with my wife. And he was still in New Mexico at that time. And we went down and had an appointment for Wednesday morning. Wednesday morning came, and Eleanor's blood pressure had gone up. It's about 4,000 feet elevation there, and so he thought maybe that was it. So he said, well, put her on medication, and I'll come down on Saturday and do this for you. And I said, well, gee, thanks a lot. That was, you know, not many people would give up their Saturday and do this, but he was willing to. And then he said, oh, but there's only one problem. And I said, oh, what's that? He said, well, I'm not going to have an assistant. My assistant's going to be taking some boards. And I said, well, how about me? And he said, well, if you can stand me, I guess I can stand you. So that was the best thing that ever happened to me, because you can't really see this very well watching somebody else. But assisting, you see everything that's going on. And so incidentally, I did that root canal in 1970, and it was beginning to show signs here. Anyway, there were actually about 3 different cavitation areas here, and they all surrounded the mandibular nerve, so it was quite a task to get rid of all of that dead bone and not injure it. And that nerve was floating in the breeze like the hazard of a halyard on a boat. And then he took this tooth out and he says, "Hey, George, that was a pretty good root canal. There wasn't any sign of any infection at the end of it. Even though it looked like it was beginning to break down here, it was all quite clear." I said, "Well, but it had bacteria and it had tubules, so, you know, that's not it." And then he got into this. And that completely surrounded the mandibular nerve, so we had that all over again. It took about 2.5 hours, I think, and when we were through, when he was through, he said, "Dellner, you want to sit up?" And she says, "Yeah." And he said, "You want to stand up?" And she said, "Yeah." And so she stood up, and she said, "My God, my back pain is gone." Just that quick. How much of what you know is wrong, and unfortunately in dentistry, there is so much that I don't know where to start and stop sometimes of talking about it. Nothing more frightful than ignorance in action. Well, if I still look a little frightened, I am. Routine dental extractions routinely produce cavitations, and this is what we've been talking about here. Uniform Consent is by Thomas Levy and Hal Huggins, and they sent me a copy, but I haven't had time to read it as yet, so I can't talk about it. In talking about cavitations, most of you know that the long bones often have cavitations as well. And most of the time they occur near the joint areas where there's more stress created. And you got to picture that bone is a very dense substance. And when bone is under a lot of stress, that bone builds up more bone around it to protect itself. And sometimes that buildup of new bone around it will be sufficient that it will close off the little capillaries, blood capillaries that are feeding nutriments to that bone. And once that happens, that bone dies. Well, it becomes dead bone. That in itself is not a problem initially. But when you have a bacteremia sometime, you cut yourself and you introduce bacteria, or you go to the dentist and he introduces bacteria. You have all kinds of things that can introduce bacteria. Those bacteria floating around in the bloodstream will get in that area, and they love that dead tissue, and so they set up an infection in it, and now you got infected dead bone. And so the physician has to go in and clean all of that out. Well, when I first learned about these cases in the oral cavity, I said to a number of physicians, "Is this the same thing?" And they said, "Oh, no, this is osteonecrosis." Well, osteonecrosis, ischemic osteonecrosis. Ischemic osteonecrosis means ischemia is blood supply, poor, and necrosis is dead bone. And so I said, well, it sounds like what we have, and certainly I was intelligent enough to know that bone in the mouth is under a lot of stress. You get people that gnash their teeth and grind their teeth and grit their teeth. You have orthodontics that are done. You have injuries to teeth. You have all kinds of things that put pressure on teeth that can cause ischemic osteonecrosis. And so you have other reasons than extraction of teeth. But extraction of teeth causes more of them in the mouth than any other thing that we have. And this is mine, and I won't take time because I don't know how my time is. Is it all up?
2 minutes, Jordy.
Okay, thank you. This is the one I wanted to see and I referred to earlier. This is a man who had trigeminal neuralgia, tic douloureux for you who are French and don't understand English. He didn't want to have the face surgery to stop the transmission of the pain to the face muscles, and he eventually committed suicide. And he wrote a letter to Dr. Jerry Bacot. He had learned about him, and he said, "Dr. Bacot, I'm willing my skull to you to do an autopsy perhaps you can find some reason for me having this disease, and if you can, maybe you can help others who have this problem. Those of you who know anything about trigeminal neuralgia know the textbooks all say no known cause, no known treatment. And so when he did this autopsy on the mandible, this was the third molar area. And of course it's very clear that that's a cavitation in the mandible. What's not so clear is that these dark bone cells, these are dead bone cells coming from here. Now you can see why when the dentist is doing this surgery, it's easy enough. Well, it isn't easy enough either, but he can get rid of this pretty well, but he's got to get rid of these things too. And that's not as easy to determine and to see. And so sometimes you've had this done and you have to have it done again because they find out it has come back again, and because these things will grow and create another one. But most of the time, I think Chris says that the chances are like 25% or something. We see some dentists where it's 50% or 100% because all they do is drill a little hole and then clean out a little stuff and close it up again. And they're not doing it very well. Unfortunately, that's happening in some areas of the country, and we have a hard time discovering it until we get a history of it. Oh, this is where the mandibular nerve runs, and notice that the dead bone cells are clear around it. We talked about it being around my wife's. You can see what happens. And so you have to be careful you don't destroy that nerve, because the patient will end up with a numb lip eventually if you do. So these are delicate surgeries and they're time consuming. You still think I'm an alarmist? All teeth are on an acupuncture meridian. And wherever that meridian goes from that tooth, if you have a problem in that tooth, it could cause a problem in that gland, organ, or tissue. Let me tell you, if you had an easy one to know, thank you. Easy one to know is if you had gallbladder problem, the dentist would know, if he knows about this, that's on the eye tooth or cuspid tooth meridian. Now, he would immediately look at the chart and see whether you've got a problem there and your x-rays and see whether you've got a root canal filled tooth, a periodontal pocket, a big cavity, or something of that sort on a cuspid tooth. If so, he would say, we got to take that tooth out, and you have the tooth out, and usually the gallbladder trouble disappears. Now, the main reason for bringing this up is this third molar area. Because whether you have the third molar or it's been removed, 95% of people still have cavitation infections in those areas. And I'm telling you, most people have had their third molars out, and almost everybody, some of us think it's almost 100%, that you test have got cavitations in those areas. And so people say, gee, those weren't infected teeth, they look like good teeth. But most wisdom teeth are crowded, and there's problems within the gum, and they may not be chronic, so the dentist doesn't recognize that part of it. The important part of bringing this up is that third molar is on the heart meridian. And one of the biggest reasons for so many heart attacks is there are so many root canals being done today, 30 to 40 million of them. Thank you very much. Sorry for running over.
George, I want to give you the money they owe you for saying all those nice things about me.
Oh, he's always got a good joke for us.
You have some handouts, right? Merit said there's some handouts that you have. She has a packet of them.
Oh, yes. I
So-
told her not to put them in there, and so you look at them before, because you would ruin the surprise of hearing it.
So there's one handout to George's lecture, so stop by the desk and get one from Merit. We're going to take a little break now, but I have a couple announcements before you move. Make sure your cell phones don't go off during the lecture, so you want to put them on stun or silent. I'm sorry. We're going to break now. We're going to come back at 11. I'm going to make some announcements. If you have some cell phones, you might want to turn them off during the lecture or put them on vibration mode. We have a lecture that's sponsored by the pleomorphic product. Would you like to come up, Colonel? Now, a lot of you notice there's a lot of Germans around here today. Don't panic. This is Colonel Mueller, and he is on our side. Okay?
That's not always been that way, I might add, you know. As when I was in the service side, we always had to write about our background. And one of the stories that I once wrote, this was when I was a captain after I came back from Vietnam, I wrote a story about when you Americans done pictures used to bump the shit out of me. And when I was a kid, I'm so because I was a kid in Germany, 7 years when the war ended. And the gentleman, the officer who rated the report, did not give it very good ratings for that. You know, I'm an American officer with some awards, you know, like this. And it took me two levels up to get to the one-star general, so he would let me write the report as the way I saw it. So anyway, that's a little side story. But besides that, if you've been here last year, the year before, we sponsored lunches then as well. In fact, 2 years ago, Dave Nye, DDS, spoke on our behalf. This last year, Dr. Gigi Klinghardt did. And this year we have Dr. Mike Margolis, also DDS. And he's going to talk about what he uses in his practice and on how to get it covered by insurance. So that might be good for you to listen to. So anyway, we will sponsor that for you at lunch, and other than that, I'll see you out of the booth. Thank you.
Thank you, Colonel. Make sure you visit the exhibitors. There's some really interesting devices back there, nutritional things, homeopathy, things that can help you in healing your patients. Along the works of what George was talking about, if you haven't ordered the set of books by Weston Price from the Price Pottinger Foundation, they're $120. They're excellent for your library reference materials. So we have a luncheon at 12:30. At 6 p.m. tonight, we have our annual hospitality suite at 350, room 350. And that's, at least to me and my liver, that's the highlight of our seminar this weekend. Just some notes from my own brain here. There's a book that you all should get called Asset Protection for Physicians and High-Risk Business Owners. You can get it off the Amazon.com. It's the author's name, Mintz, M-I-N-T-Z. It's an easy-to-read book. It's short, but you need to protect yourself from suitors and creditors and things like that as high-risk practitioners. Asset Protection for Physicians and Other High-Risk Business Owners. Mintz is it's an attorney who wrote, M-I-N-T-Z. It's excellent. It's real short, easy to read, and I'll tell you what to do as far as you're setting up your limited liability corporations, family limited partnerships, what to avoid, what to get into to protect yourself.
Chris, say the title one more time.
I'm sorry.
Slowly.
Asset Protection for Physicians and Other High-Risk Business Owners. Asset, A-S-S-E-T-T. Never assume anything. Asset. And the books by Price Pottinger, they're $120 of works of Weston Price. We are lucky to say that we set the record today for attendance. It's at an all-time high, and some of the exhibitors have not paid to come to the lectures. They have a red dot on their tag. So if a room gets full with doctors who have paid, we ask you to sit in the room next door to make room for the people who have paid. And I think that's it. Any quick questions? See you back here at 11 for another great lecture by Tom Thomason.